All right, Joanne, you want to go ahead and kick it off, and then I'll get these other people admitted since we are minutes after.
Okay.
Thank you.
Hi, everybody. Thanks for joining us. As you know, we have Dr. Nancy Brown today. And to give you a little bit of background about Dr. Brown, Dr. Brown discovered in 2016 that chronic Lyme disease was responsible for the worsening psychiatric and physical symptoms she had faced ever since her back surgery 2 years previously. This discovery revolutionized both her life and her practice. Since then, she has pursued extensive training in tick-borne infections, mold toxicity, mast cell activation syndrome, EMF toxicity, and hypercoagulability. She now uses her many years of clinical experience, her pattern recognition skills, and her commitment to finding the root causes of illness to diagnose and treat those with elusive, complex, treatment-resistant, multi-system illnesses. Nancy's own experience with her illness, being a very sensitive and reactive patient with many treatment challenges, has allowed her to relate closely to her patients and support them from a very personal perspective. She is passionate about treating patients with these illnesses and continues to pursue knowledge of the most up-to-date treatments. And as many of you may or may not know, she has a practice here in Louisville, Colorado. So if you want to go ahead and kick it off, Dr. Brown.
I'm pretty informal, so everybody can call me Nancy.
Oh, okay, okay, great.
and first of all, I just want to say thank you to Jody and Joanne. You guys have done a great job of taking over from Billy. And I just want to really thank you for keeping the support group going. I think everybody needs this. And I always encourage my patients to participate in some type of support group. It can be a very lonely journey. And even when you have very supportive friends and family, they don't get it the way somebody else with Lyme gets it. And I think it's important for all of us to recognize that we're not alone, and what we're going through is very unique. And it's really nice to have people around who really know what it feels like. Okay, so, and thank you all for being here. I'm thrilled to see all of you. Many of you I know, but some of you I don't. So thank you for being here. Just as a preface, what Joanna had asked is for me to kind of give you an overview of how I approach treatment with Lyme patients. From my perspective, I'm a big picture person, okay, really big picture. And so it's a little overwhelming to try to condense that into something that's digestible. So I warn you ahead of time that you may feel like you're trying to drink out of a fire hose over the next hour. But don't worry about that. Just take it in, okay? If you've got questions, write them down. We're gonna be doing a Q&A after I'm done talking about how I approach these diseases. I'm more than happy to stay until everybody's questions are answered. And I don't know, for those of you who aren't my patients, whether this type of approach is going to be something that resonates with you and that you've experienced, or if it's something really different. So let's just jump in, see what happens. So the first thing I'm going to do is just tell you a little bit about my story, because I'm a Lyme patient, and that's one of the reasons I'm here. And in the past, I have participated in this support group. I haven't been with you guys for quite a while. And then I'm going to talk to you a little bit about my approach to treatment. So here's how it goes. I moved to the Hudson River Valley when I was about 20, stayed there for about 6 years, then moved to Boston for med school and was another 5 years in New England. Sometime during those 11 years, I more than likely got bitten by a Lyme-infected tick, but had no idea, which is true for many of us. And other than having some bouts of extreme depression that were intermittent and that resolved reasonably well, I was pretty healthy until I had back surgery about 30 years later. And during the surgery, I got an extremely high dose of steroids because I had had previous problems with extreme nausea during surgery. And the anesthesiologist said, well, no problem. We'll just give you a lot of steroids. I'll take care of it. Okay. I felt great for about 2 months. I was just sailing. Those steroids knocked out all of my inflammation. My mood was great. I had no problems. And about 2 months later, I totally crashed. And within a few days, had overwhelming, relentless suicidal depression and was completely non-functional. Thank goodness I responded to antidepressants, and, you know, within a week was, you know, able to do what I needed to do. Then over the next 6 months or so, I developed a multi-system disease. I had fatigue, I had brain fog, I had incredible overwhelm, and I had no idea what was going on. But because the depression was my primary symptom, that was what I focused on. I had no idea that multi-symptom illnesses existed and that all these things were related to each other. I went to a psychiatrist, a functional psychiatrist, got some good ideas about supplements I could take, but she also didn't have, at that time, did not have an education in how tick-borne diseases can primarily present with psychiatric illnesses. And so that wasn't on her radar, it wasn't on mine. So fast forward to about 2.5 years after my back surgery. And, you know, life was pretty miserable at times, but I managed to continue to go to work and be semi-functional. I decided to go to a local Lyme lecture. It was about 4 years ago, and I think many of you were probably there. Dan Kindler and Denise Clark talked for a day about Lyme disease. And I had several patients in my practice who had Lyme disease. And of course, you know, you don't learn about it in medical school. And I said to myself, okay, let's go hang out for a day and learn about Lyme disease, and then I'll know more about what's going on in the patients. And about 2 hours into the lecture, my jaw was on the floor, and I was having a very heated discussion with the universe saying, I did not come here to find out I have Lyme disease. This is not okay. And my second conversation with the universe at that point was, and oh, by the way, I am not going to be a Lyme doctor. Okay. So I talked to Dan at one of the breaks and gave him a very brief history, and he looked at me and he says, you've got Lyme disease. And I got tested, and I think my IGeneX test was one of the most positive I've ever seen. It lit up like a Christmas tree, so there was no doubt about it. Dan graciously agreed to be my treating physician, and he also agreed to mentor me. So I spent the next couple of years hanging out with him in his practice for 1 or 2 half days a week, and he taught me a tremendous amount. Just backing up a little bit, right around the time of my back surgery, I started working with Eric Dorninger. I was very blessed to be able to do that, and he taught me the entire Shoemaker protocol. So by the time I finished with Dan, I was Lyme literate. I was mold literate, and I was ready to move into treating patients, which is always an adventure. and I will say that as a patient, I am always on a steep learning curve. I'm always learning more about what's going on with us and what I can try next. And of course, like all of you, trying to figure it out. What can I do to feel better? What can I do to get into remission? As a physician, I'm on that same really steep learning curve, which is how can I help my patients? What's going on here? What's the newest information in the field? There's a couple conferences that I go to without fail every year because all of the thought leaders in this field are there. And I was frustrated this year that both of them were virtual, and I couldn't, the medical term for it is curbside. I could not curbside any of my favorite practitioners and say, okay, so what would you do in this case? You know, when it's virtual, you can't do as much of that. So I really missed that. And I miss networking with other people who treat these kinds of illnesses, because again, like being in a Lyme support group, when I go to those conferences, I'm hanging out with people who see the medical world the way I do. And they're not going to give me a hard time about being a Lyme doctor. And we can talk about the challenges that we face doing that. Anyway, I always go to those conferences. I learn a lot. Bottom line is, I feel really good about what I'm doing. You know, I'm one of those people with pretty deep spiritual / metaphysical beliefs. Not particularly religious, but it depends how you view that stuff. And from a very foundational place, it's very clear to me that this is what I'm meant to be doing right now. I enjoy it. It can be challenging and frustrating at times, but there's nothing more satisfying than having somebody tell me that they feel a lot better because of what we've done together. And, you know, like all of you have experienced, it's not a straight and narrow road. There's lots of ups and downs. There's lots of experimentation and trying to figure out what's going to work and what isn't going to work. You know, trial and error is the way I approach treatment, because I joked with somebody the other day, and this is absolutely true. There are as many different ways to treat Lyme disease as there are patients and Lyme practitioners, okay? There is no one protocol that works for anybody. And the way people respond is a function of their genes and their environment and their past experiences. And there's no way that, you know, we're all similar in those examples. So there's a lot of, in being a Lyme practitioner, there's a lot of living inside the question. In other words, being able to say at any moment in time that I don't have the answer, I don't have the complete answer, I'm always learning. And, you know, I wish the reality was that there was a nice simple protocol and we could all do it and we'd all get back to feeling like our normal selves. But we all know that that's not the reality. So I approach treatment very individually, but I do have, again, I'm a big picture person. I do have an overview that is similar for everybody and that guides my approach. So I think Joanne sent you guys a couple of handouts. Did that happen, Joanne?
No.
No?
No, I didn't get any handouts from your office.
Okay, I had asked them to send, and I should have double checked before I left on Friday, so my apologies. But you guys can get a piece of paper and write things down if you want. What we're gonna do is kind of do a lot of big picture overview stuff, and then I'll give you a little bit more detail, okay? So the first sort of big picture question I wanna start out with is, why are we so much harder to treat than we were 15 or 20 years ago, or even 30 years ago? And if you talk to Lyme practitioners who've been doing this for 30 years, they will all universally say that patients are much more difficult to treat, much more challenging. It takes longer. There are many more ups and downs on the roads, and there's many more times that people can get significantly worse and then have to, you know, get back to slowly climbing up the ladder to feel better. And that wasn't the case 30 years ago, 25 years ago, 20 years ago. The approach to treating Lyme disease is put everybody on IV antibiotics for 6 months and get them into remission, and then you're done. And it worked with the majority of people. Now we're much more sensitive. And if I did that to the majority of my patients, they would all get much worse and would not be happy with me at all, for good reason. So what's happened? What's made the difference? And first thing is, we are all much more reactive, hyper-reactive than we used to be in the past. And it makes treatment much more difficult. We have to go slower. We have to introduce things slowly. We have to wait to see if you have a bad reaction to it and then adjust our plan. Now, again, what I'm going to be talking about today is, this is the world from my perspective, okay? This isn't based on scientific literature, okay? If I go to these conferences and talk to other Lyme practitioners about my ideas, I get a lot of positive feedback, and people say, yes, that's what I've seen in my practice too. But there isn't a body of literature that says, oh, this is what's true, okay? And again, especially in the business of Lyme disease, I don't think there is one truth. I think there are a lot of things that are most likely true. And that's kind of my perspective from today. So in terms of why we're more difficult to treat, there's 3 things that are on my list. I'm sure there are other things, but I think these are the 3 most important. And number 1 on the list is electromagnetic field exposure, EMF exposure. If you look at graphs of EMF exposure over the last 20 years, it's just gone up and up and up exponentially. And our bodies are electrical. each one of our cells communicates with every other cell in our body through microcurrents. To imagine that we can be bombarded with all these electrical fields and not have it affect us physiologically is just ridiculous. And yet, just like global warming and tobacco, we are at a place with EMF where the vast majority of people just don't get it, and they don't want to get it. It's an incredibly inconvenient truth, okay? Especially, and I apologize for being gender specific here, but people with Y chromosomes in general tend to be addicted to their toys, and their toys are all based on the internet. And it can be really challenging for people to really realize that this stuff can have an adverse effect. So EMF is very high on my list for reasons why we are more reactive and more difficult to treat. The second thing is mold. You know, since we changed our building practices back in the late 70s, there's more and more mold in homes and in workplaces when there's water damage. And the EPA estimates that 50% of all buildings have water damage. Okay, it's very common. It really doesn't have a whole lot to do with the humidity of the climate that you live in. It simply has a lot to do with the building practices of your home when it was built, and whether you have any pipes that are slowly leaking behind a wall. You're not going to see it, you're not going to smell it, and it is going to profoundly affect your health and your ability to get better. It also is something that fuels hyperreactivity and makes us more difficult to treat. And the last thing on that list is glyphosate. Okay, glyphosate, there's a woman at MIT, PhD, who's done a lot of research on glyphosate. Her name is Stephanie Seneff. If you want to do some research, there's some amazing stuff that she's done. But basically, the way glyphosate is constructed molecularly is that it can insert itself into your DNA, okay? It doesn't get any more invasive than that. And bottom line is that it really compromises your immune response, and it also fuels hyperreactivity. So hyperreactivity is on the top of my list of things that make us more difficult to treat. And number 2 on the list is that our immune systems are much more compromised than they used to be because of all of our environmental toxins, specifically mold and glyphosate and EMF. Okay, so that's kind of the big picture there. Next, I want to talk about the overall illness itself, and I want to talk about the top 5 things that I see and that I believe are the crux of what causes your symptoms, okay? I'm going to start off by saying that with these illnesses, it is always, always multifactorial. And I'm going to list 5 things that I think cause almost all of the symptoms that we have. I'm going to list them in order of how often I see them in my practice. And this is, again, this is just my observation, and it really is a gut feeling because I haven't sat down and counted up patients, okay? So I'm giving you my best guess as to what percentage of my patients have these things. And I will also preface this part by saying that most of the people who walk through my door have some form of hyperreactivity and are difficult to treat. If they've been diagnosed already with Lyme, they've usually seen other providers before they've seen me. So I have kind of a skewed patient population. And this might not be true for somebody else who practices in these areas. But for me, this is more or less what I see. So we're going to go down in order of what I see most often. And if you want to jot these things down, feel free. So number 1 is tick-borne disease. 95% of my patients have tick-borne disease. And if you have tick-borne disease, you never have one. You always have more than one, okay? So this theme of it's always more than one thing is universal, okay? So, and you guys all know about Lyme and co-infections. I don't need to go there with you. The next thing that is most prevalent is mold toxicity, and 90% of my patients have that. 90% of my patients have both mold toxicity and tick-borne disease. They tend to go hand in hand. My personal theory about that is that somehow there are certain genetics that we all share, everybody who's on this call, that predispose us to not being able to clear mold toxins if we get exposed to them, because 85% of people who live in a mold damaged building don't get sick from it, but 15% of us do. That same 15%, if they get bitten by a Lyme infected tick, will most likely at least carry that long term, if not be actively symptomatic from it long term. Okay, we don't clear these organisms from our body, and anything that compromises our immune system then makes the infection become more likely to cause us problems. Third thing on the list is limbic system dysfunction. 80% of my patients have this. It's one of the things that drives the hyperreactivity that many of us deal with on a day-to-day basis. So I'll give you a quick overview if you haven't heard about this. Your limbic system is the part of your brain, the primitive forebrain, that is concerned only with survival. And it's only concerned with survival over the next 48 to 72 hours, okay? When it gets turned on, all right, it means that your body thinks that it's going to die in the next 2 or 3 days. And the limbic system takes over, it gets total control. It can run everything because your priority is to stay alive until help can come. Now, when we evolved thousands of years ago as hunters and gatherers, if something happened to you, either you had an injury or you got some type of illness, there were going to be 2 outcomes, and it was going to be pretty fast. You were either going to die or you were going to get better, okay? And so our limbic systems were formed and evolved at a time when chronic illness did not exist. It wasn't a possibility. So we're still in that place where when the limbic system takes over, its whole focus is going to be on keeping you alive for the next 2 or 3 days until you either get better or help comes or you die, okay? Now, there are several things that will turn it on. One of the things that universally turns it on is the amount of inflammation that we all deal with in our bodies on a 24/7 basis, okay? When you have high levels of inflammation, that the limbic system interprets that as being that you are in mortal danger, okay? The second thing that will turn this on is when you are in a place of fear emotionally. And I can expand that and say, you know, when you're in a situation of intense drama, when you are feeling threatened by anything, you know, your body interprets that as being very important, and we need to keep you safe, okay? So when the limbic system turns on and takes over, what happens is that every single pathway in your body that is concerned with long-term healing gets turned off, okay? Your body doesn't care if you're alive in a month from now or what your quality of life is a month from now. It only is focused on keeping you alive for the next 1 to 3 days, okay? In its attempt to pursue that, what it does is, on a cellular level, it decreases your mitochondrial production of energy anywhere from 30 to 50%. That's huge. Every single cell in your body does not make energy the way it needs to because the limbic system is trying to conserve your energy so that you can get well, okay? So your limbic system is very well-meaning, but it doesn't work very well for us when it's turned on. And so we need to figure out ways to turn it off. We're going to talk about treatment in a little bit, but one of the most important things that you can do to help yourself get better is to turn that limbic system off. And there's some really good methods for doing that. The fourth thing on my list is mast cell activation. About 65% of my patients have this. It is a manifestation of some of the things that I started out talking about, the things that make us hyperreactive. One of the top manifestations of that hyperreactivity is mast cell activation syndrome. Mast cells are a subset of your white blood cells. It's part of your immune system. Most of your mast cells are found in your body between your neurologic system and your immune system. So they're communicators between your neurologic system and your immune system. When they get overreactive, they either get leaky and they leak their contents, or they actually can rupture. And inside of them is a lot of histamine. So some people can refer to this as histamine sensitivity, okay? But it's a lot more than that, because they also release inflammatory cytokines when they rupture or when they leak. And mast cells are everywhere in your body. So when mast cells are activated and they release those inflammatory cytokines, it increases the inflammation in your body, sometimes exponentially. And every single one of the symptoms that we have gets worse when your inflammation is worse. So mast cell activation, when something has gotten that going, is going to make every symptom that you have significantly worse. However, the opposite of that is, if you can treat the mast cell activation, if you can quiet them down, then all of your symptoms will be better, and it can happen fairly quickly. Oh, hang on. I missed something. Let's go back up to the limbic system being stuck in overdrive real quick. One of the things that is also very high on the list of things that cause the limbic system being stuck in overdrive is previous trauma, okay, PTSD. If you've had significant traumatic events in your life, what happens at that moment in time is that your limbic system totally takes over, okay? And anytime anything comes along that reminds your body of that trauma, that limbic system gets turned on automatically. It's sort of it's not set in stone because there's something you can do about it, but if you don't do anything about it, it is a pathway that is set in stone. And anytime something similar to that trauma happens to you, or you think about that trauma, or you're stuck in an emotional loop about that trauma, then the limbic system gets turned on again. And it doesn't have to be something that is exactly like what happened to you previously. It can just simply be something that puts you in a place of fear, like watching the news. So it is something that you can do a lot about, and we're going to talk about that. So mast cell activation syndrome, again, we're coming from my perspective, from my practice, but there's three things that I see that are the major causes of it. And number 1, 2, and 3 on that list is EMF exposure. I can't tell you how many patients I've seen that when they got their EMF situation remediated, their mast cell activation got much better. The second thing on that list is mold exposure, okay? Especially Bartonella tends to push that mast cell button. And then the last thing on the list is mold exposure, okay? And there are certain molds that definitely push that button. Not all of them, but many of them do, okay? And then the last thing on the list is hypercoagulability. About 55% of my patients have that. It's something that's fairly new on the horizon with Lyme literate doctors. Very powerful lecture that I heard in the spring by Dr. Ann Corson, who's a family doc who's been treating Lyme in Eastern Pennsylvania for 15 or 20 years. So here's a statistic that she talked about that just completely blew me out of the water. But hang on first, let me just define what hypercoagulability is. It's a big long word, but basically it just means that your blood clots easier or faster than most people's, okay? On a very functional level, what that translates into is that your red blood cells are sticky, okay? They don't flow past each other easily. Now, when your blood is flowing through a big vessel, that's not a big deal. But when your blood is flowing through capillaries, those red blood cells have to go single file through those capillaries. And those capillary beds in your body are where all of your oxygen exchange occurs and all of your nutrient exchange occurs. And if the red blood cells are sticking together as they move through those little tiny capillaries, okay, that oxygen and nutrient exchange is going to be compromised, okay? So stop and think about, how is your brain going to function, okay, if those red blood cells are sticking together and you don't have optimum oxygen exchange to your brain cells? You know, how are your muscles going to function if you don't have optimal nutrient and oxygen exchange in those tissues? You know, it affects your entire body. Now, the statistic that I referred to when we started talking about this is What Anne told us in that lecture is that if you test everybody in the general population and you look for the 4 genes that we know of that can cause this condition, and I'll say there's probably more, we just don't know about them, but for those 4 genes, about 25% of the population has at least one, okay? If you look at every single one of us and every single patient who has a multi-symptom complex chronic illness, okay, that incidence is at least 95% of us have 1 and 85% of us have 2 of those genes. So bottom line is hypercoagulability is really common in us, and there are certain symptoms that go along with that. So I'm just going to read through those fairly quickly because this is probably one of those things that's going to be fairly new to a lot of you, and I don't want to go over it too quickly. So here are some of the symptoms that would tend to indicate that hypercoagulability is at a root cause of it, okay? Your arms and legs fall asleep easily. You have restless leg syndrome. You have what we call motor restlessness during the day. You can't seem to stay still. Stiffness and pain on awakening, nausea on awakening, and or poor morning appetite, painful teeth, or a feeling like your teeth are loose, post-exertional fatigue, shortness of breath. That's one of those symptoms that is really hard for people to live with, and it's very challenging for Lyme docs to treat. We all assume when you have a lot of shortness of breath, especially without exertion, that you've got babesia, okay? However, it can take a long time to treat babesia, okay? I've been in treatment now for, God, how long has it been? 3.5, close to 4 years. And I still can't find a medicine that I can tolerate for my babesia. And it's one of the things that causes me the most symptoms. However, if you can increase the blood flow through the capillaries in your lungs, that shortness of breath goes away. And I've seen it happen now that I'm starting to treat this. It's pretty miraculous. Now, cold and clammy extremities, like your hands are cold or pale. Mottled skin, which a lot of us associate with Bartonella, but is also associated with this poor flow through your capillaries. Pale and swollen tongue with scalloped edges. Soft tissue congestion, which basically means that you're the Pillsbury Doughboy, okay? Everything is swollen a lot of the times. Things feel puffy, okay? It's one of those things that I don't see terribly often in my patients, but when I do, I have no idea what to do with it until I heard about this. Also, your head and neck get purple when you lay down, or when you're standing, your feet get purple, okay? If you have any of those symptoms, it's certainly possible that the hypercoagulability, it's hard for me to say that, is contributing significantly to some of your symptoms, okay? Now, I will tell you from my perspective again, but I will tell you from my perspective without a doubt, if you have Lyme disease, you have at least one of these other 4 symptoms or conditions, one of these other 4 conditions also, okay? So remember, I started out by saying this is multifactorial, all right? I will also say absolutely, and I would love to be able to do a study and prove this, but from my perspective, absolutely, if you have been in treatment for more than 3 years, you probably have all 5 of these in at least 4, okay? So let's go through them again. Tick-borne disease, mold toxicity, limbic system overdrive, mast cell activation syndrome, and hypercoagulability. All of these things together are creating the vast majority of your symptoms. And if you have them and they're not addressed, you're not going to get into remission, okay? Now, we're going to talk about treatment approach. And not sure whether to put this in now or put this in later. Let's put this in later. Let's talk about treatment approach with these 5 things, okay? So I'm not an idealist, okay? I'm not even a realist. I'm a pragmatist. My approach to things is, as Tom Cruise would say, you know, show me the money. I want to know what's going to work to help my patients feel better. And although my left brain loves to know what the theory is and why it works the way it does, as your provider, I want to know what's going to work. Okay. And the way I make choices about where we're going, what we're going to do next, is what worked in the past, what didn't work, what caused a bad reaction, and that helps inform me as to where we're going to go next. So what I have found in my approach to treatment is there are 3 things that are at the top of my list and that I address simultaneously. And none of them are tick-borne diseases, okay? Regardless of whether you have them or not, it's not the first thing I'm going to do. And a lot of that has to do with the fact that so many of my patients, 2/3 of the patients who walk through my door have mast cell activation syndrome, and they're sensitive and they're not going to respond to treatment very well if the mast cells are active, okay? Mast cell activation syndrome will cause you to herx very easily. It means that you need to start treatment slowly and progress slowly, because otherwise it's going to make you worse. We're talking about the patients that Neil Nathan wrote his book about, Toxic. And if you are a hypersensitive patient and you haven't read that book, I really encourage you to do that. Neil's a genius, and he really understands the complexity of working with highly toxic, highly sensitive patients, most of whom have mast cell activation syndrome. So MCAS is the first thing out of the box that I'm going to address with treatment. And it's a condition that is not easy to diagnose with lab tests. There are probably a good, 5 to 8 lab tests that you can do looking for this. And most of them are extremely difficult to do. The sample needs to be handled in very special ways. And to be honest, the people who are drawing your blood at LabCorp don't really have the educational bandwidth to do it the right way. So and oftentimes insurances don't pay for these either because they're weird tests. So I don't bother with a lab test because I find that they don't really help very much. There are a couple of basics ones that I will do that LabCorp has no trouble running. They're routine labs. Your insurance will pay for them. There's 3 of them, histamine, tryptase, and prostaglandin. And if those are high, it confirms the diagnosis. But if they're not, it doesn't mean you don't have it. All right. And so I do that in my first round of routine labs. But mostly what I do to diagnose the mast cell activation syndrome is I give you a trial of medication that will help stabilize the mast cells and quiet your symptoms. If you respond to that significantly, okay, if you come back to me a month later and say, I feel a lot better on this, then, and you have all the symptoms of mast cell activation, then that confirms the diagnosis, okay? If we find out that you have it, then my first priority is going to be to treat the mast cell activation as assertively as we can, keeping in mind that if your mast cell activation is way over here on the scale, okay, we're not going to treat it quickly. We're just going to have to go slow. But it will help in the long run. Now, if your mast cell activation is only mild to moderate, then we can get you on board with medications fairly quickly. And ultimately, my mast cell patients are on anywhere from 4 to 6 different prescription medications and or supplements to control the mast cell activation. Once the mast cells are more stable, then you're much easier to treat. You're less likely to have reactions to any further treatment that we're going to give you, okay? Also, this is the one thing that I can do for you fairly quickly with not an overwhelming expense, okay? These kinds of treatments are going to be expensive. You can't get past it, all right? But the amount of improvement or bang for your buck that you get with mast cell activation is totally worth it. I've had people come back and feel 50% better after being on a trial medication for a month, okay? Now, that doesn't happen with everybody, but it's possible. So what I see with treating mast cell activation first is, number one, You get better fairly quickly as long as you can tolerate the medications. It's not going to cost you a ton of money. And number two, it's going to help, or number three, it's going to help future treatment, and you're going to tolerate it better. Okay. The other thing that I will say about mast cell activation is that, again, we talked about it earlier. One of the major drivers is electromagnetic field exposure. And I've had tremendous success in treating mast cell patients with decreased EMF exposure and having them get dramatically better over the next several months. I think it's a major driver for a lot of patients. You know, it's not universal, but especially if you have mast cell activation syndrome, you really, really need to look at this. I will give you a clue. Well, number one, if you go to my website, and the website is Integrative FM, as in family medicine, which is the name of my practice, integrativefm.com. And on that website, you will find a tab for resources, okay? And under that tab, if you don't know him already, is Ryan Ashley. He's local in Louisville. He travels all over the Western United States to do this work, and he is a building biologist whose expertise is in the field of electromagnetic fields. He will walk through your door with his thousands of dollars worth of German equipment and do a complete inspection, tell you where in the house you have problems, and he's also a problem solver. He will help you figure out what to do about it, okay? The first thing that I will say to you from a very, again, pragmatic and practical perspective is that if Comcast/Xfinity is your internet provider, there's no problem with that. But if you are renting their router, you are being inundated with huge EMF 24/7, okay? They have a mini cell tower or hotspot inside that router that has nothing to do with your Wi-Fi signal, okay? It has everything to do with the fact that Comcast wants to be able to stream their material to someone who's driving past your house. And so that sends out a signal for about 2 to 3 blocks. And basically they put a mini cell tower in your house and they're charging you $13 a month rent for that router so that they can broadcast their signal. And that signal is high enough that it is a major, major source of EMF, and it will make you worse. So get rid of your Comcast routers, okay? It's really easy to do. Just go buy your own, okay? And then have somebody who's tech savvy install it if that's not you. It's not a big deal. It's fairly easy to do. The hardest part about it is just having to sit on the phone with customer service at Comcast for a half an hour to get them to get the signals matched. But after that, you're fine. And then you can take their router back to them and say, thank you very much, take this off my bill. And I guarantee you will feel better. Now, some of us are sensitive enough, and this happened to me, that when you do that, you may feel worse to begin with. Ryan suggested that I do that. I did it right away. I went through 6 weeks of feeling significantly worse. But my internal conversation was, okay, if I'm feeling this bad when I took it away, because my body is now, you know, our bodies do the best they can to adapt to these situations. And I'm like, okay, if my body had to adapt that much that I'm having this amount of withdrawal when I take it away, then my guess is, and I'm hopeful that when I get through the withdrawal reaction, I'm going to feel a lot better. And that was absolutely true. It made a big difference in my symptoms. So, you know, I'm probably fairly personally biased about this issue, but EMF is a big deal. Please don't ignore it. So mast cell activation, mold toxicity is next on the list. That's also addressed primarily in that first and second visit. I want to do a urine mycotoxin test and find out if you've got mycotoxins, and then we're going to put you in a mold treatment protocol. Number 1, 2, 3, 4, and 5 of that mold protocol is to get in a clean environment, and it is absolutely essential for your recovery. Okay, mold toxins are extreme immune suppressants. You cannot take an antimicrobial that is designed to kill tick-borne diseases and have it work if your immune system can't partner with it, okay? That has to happen. There's nothing on the planet that is antimicrobial without the help of your immune system. You can take antibiotics till the cows come home. And if you're in a moldy environment, you might feel somewhat better. But you will not get into remission. So, or if you are an extremely rare person who does, you won't stay there. Okay, so you have to be in a clean environment. You have to address this first. And then there's, you know, we'll put you on binders to get the toxins out. We'll give you detox support. We'll get you on a systemic antifungal at some point. You know, all those things will come down the line, but the very first thing you have to do is be in a clean environment. Third thing that I will usually address within the first couple of visits is the limbic system retraining. I recommend that all of my patients do either Annie Hopper's program, which is DNRS, or Gupta's program, which is just referred to as the Gupta program. Currently, I don't know if he's going to continue to do this long term, but currently I know that, that Gupta will let you do a 1-month free trial. You can get the first 3 lessons free. You don't have to pay any money. But I will tell you, this is extremely important. And if you are stuck in a place where your limbic system is turned on, just like living in a moldy environment or being inundated with huge amounts of EMF on a daily basis, you're not going to get into remission. Okay. And I recognize that a lot of these are very inconvenient truths, but it doesn't change the fact that they are true. And I wish I had a magic wand, but I don't. So those are the 3 things that I recommend simultaneously. We address mast cell activation, we address mold toxicity, we address limbic system retraining. The next thing that I will look at a few visits in is if you have symptoms of hypercoagulability, I'm going to want to get you on some treatment for that, because again, just like mast cell activation, you can get a lot of bang for your buck. Okay, you can feel better without spending a ton of money on treatment. Okay, and again, it's going to help your symptoms. It's going to help you tolerate further treatment. The last thing on the list is the treatment of the tick-borne diseases, and you guys know all about this. I don't have to tell you about it. I usually don't go down that road until I feel like your mast cells are much more stable. I feel like we're well on our way to having you in a clean environment, both in terms of EMF and mold, and that you're on, and that you're working on some limbic retraining if that's part of your treatment protocol. And then, you know, we'll talk about getting you on treatment for tick-borne diseases. Now, what happens if we've addressed all 5 of these and you're not getting better? You're not going to like my response to this, but when that happens, my go-to is number 1, 2, 3, 4, and 5 is mold, 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 because that's usually what it is. And it just hasn't been addressed properly or fully. But the next 5 things on the list are EMF, EMF, EMF. Okay. So again, I hope I'm driving this lesson home, is that your environment is critical to getting you into remission. But there are other things that can be interfering significantly. And on the top of that list is being stuck in negative emotions. Okay. If you're stuck in a place of anger, blame, guilt, resentment, regret, or drama of any kind, it will keep your limbic system running, even if you're diligently doing Annie Hopper's DNRS. Okay. If you're in a state of fear all the time, or if you're constantly replaying something that happened to you in the past from a place of anger or resentment or blame, if you're watching the nightly news, oh my God, you know, anything, you know, we are a society that's addicted to drama. Look at all the reality shows on TV. I grew up back in the 60s, 50s actually, before I went to school, watching soap operas every afternoon with my mom. She had her shows, okay, and she watched them for 4 hours every afternoon while she was doing her housework, okay. This is not something that's new to this generation. This has been going on for a long time. We crave the adrenaline rush that comes with being in a state of high drama, but it doesn't help us heal. And in fact, it's very detrimental. So do everything that you can to let go of those negative thought patterns. And I'm not going to get into details here. There's lots of things you can do. There are good PTSD therapists out there who can help. There are amazing spiritual and metaphysical practices that can help. One of the books that I will recommend a lot to patients who are stuck in this pattern is just sit down and read the 4 agreements. Okay, it's beautifully written. It's very simple and straightforward. And keep reading it as many times as you need to fully incorporate that into your life and live from that place. It'll make a big difference. Other things that will keep you from getting into remission. Glyphosate toxicity. Please eat 100% organic. Retroviruses. These are viruses, very different viruses from what you're used to. The one that most people are aware of is HIV, and all of these retroviruses tend to compromise your immune response significantly. There are many places where you can pick them up. They actually can be transmitted from your parents and passed on to your kids. And retroviral treatment can help a lot of people. Cavitations, okay, about, and you guys probably already know about this. It's pretty well known in the Lyme community, but usually from previous root canals, but can also be caused by wisdom tooth removal. Parasites, heavy metal toxicity, and undiscovered or untreated co-infections. So that's my list of things that will keep you from getting into remission, even when those first 5 things have been fully addressed. So I'm just going to ask, I'm going to wrap up here. I know we're close to an hour and I want to give you time for questions. I'm going to answer a couple questions that are often asked to me either directly or indirectly, okay? The first one is this going to be expensive? And the answer is always yes. There's nothing I can do about this. There are supplements that are really very helpful for healing that are not going to be covered by insurance. There are tests like your urine mycotoxin test or IGeneX tests that are not covered by traditional insurance, and the testing is important. There's just no way that this can be inexpensive. And if finances are an issue for you, I will do my very best to talk with you about the choices that you have and how much it's going to cost you and where I think you're going to get the most value, okay? But I can't make it significantly less expensive. Another question is, how long is this going to take? And again, entirely from my perspective and my practice, what I tell people is, if you're less than 40 years old, which means that your immune system hasn't been exposed to all these toxins that the rest of us have been exposed to for less time, okay? So if you're less than 40 years old, if you've had the infections in your body for less than 10 years, and if you do not have mast cell or hyperreactivity of any kind, then more than likely we can get you into remission within 2 years. If you do not fit those 3 criteria, it's most likely going to be longer, okay? That doesn't mean that you're not going to feel better as we move forward in treatment. You will. You can feel significantly better within the first 3 or 4 months, depending on what conditions you have and what we do. If you are an incredibly, extremely sensitive person, you have to factor that in. It's going to take time because you can't add anything in quickly. You know, we can only give you small doses of things and change that once a week, okay? So you're going to have patience, but it doesn't mean that you're not going to feel better as we move forward. Another question that is common, and I totally get this because it's an area that I have a lot of challenges with, is, do I really need to change what I eat? And the answer to that, just like the expenses, is yes, you really do, okay? It does make a difference. Eating a low inflammation diet, which means basically no grains and no sugars and minimal dairy, is huge for decreasing the inflammation in your body and allowing those systems in your body to function better that are essential for healing, like your immune system and your detox pathways, okay? There are 2 other things that I talk to people about in terms of nourishment. So number 1 is an anti-inflammatory diet, and that is everybody, I recommend that everybody follows that. Number 2, if you have mast cell activation syndrome, please avoid histaminic foods. There's lots of lists online about that. And then number 3 is, if you have a lot of gut symptoms, and I know a lot of my patients do. You should do a trial for a month of avoiding all gastric irritants, okay? And if you're curious about that, email my office. It's info@integrativefm.com and ask them to email you the list of gastric irritants. Tell them that you were at this conference this weekend. So what's going on if you have a lot of gut symptoms is that your entire intestinal tract has been wired into a state of hyperreactivity. So this ties into everything else that we've already talked about before. This is related to mast cell activation syndrome. It's another aspect of hyperreactivity. It's neurologic. And there are certain foods that make that reactivity worse. If you avoid them completely, you will turn that switch off. It's an on-off switch. So the way it works is if you avoid 50% of the gastric irritants on the list, you won't feel 50% better. You won't feel any better at all, okay? If you avoid 100% of the gastric irritants on the list, but you only do it for a week, you're not gonna feel any better either. So in order to get the switch to turn off, you have to avoid all the gastric irritants for at least 3 to 4 weeks. That will turn the switch off. At that point, you can tolerate adding in a few now and then, and you won't turn the switch on. But if you start eating them again on any kind of a regular basis, the switch will turn on and you're going to have just as much irritability as you had before. So it's an all or nothing phenomenon, okay? If you start eating irritants again and you turn the switch on, you don't have to just go back here to turn it off. You have to go all the way back here to turn it off. You have to get all the gastric irritants out of your diet for 3 or 4 weeks before the switch will turn off again. And you can play around with it and figure out where that point is for you. It's different for different people. But I will tell you that this is a tool that you can use that will really help you control your gut symptoms. But it's not going to be 100% if you have other conditions going on. So if you have parasites, or if you have SIBO, or if you have very severe food allergies or sensitivities, those are also going to play a role in your gut symptoms. But if you follow this for a month and 95% of your gut symptoms go away, then you're dealing exclusively with this gut hyperreactivity, which a lot of people refer to as irritable bowel syndrome, IBS. And it responds really, really well to change in diet. Okay, and then the other sort of overview piece that I'm gonna say, again, you've heard it many times, but I can't emphasize it enough. The two things that I get the most resistance from patients are nourishment, which we just talked about, and I'll tell you a funny story. This is real quick, but it was one of my recent new patients within the last 4 months or so. And I went over nourishment with her at the first visit. And she came back the next time and she says, I want you to know that when I left that day, I was adamant that I was going to follow this to the letter and come back here and tell you that you did not know anything about what you were talking about and that it didn't help me feel better. And she came back and she said, I'm 90% better. She says, I don't believe this. And we both chuckled, you know. There's a place in our head where we can get really attached to our nourishment. And for the most part, it's the place where our little 5-year-old kid lives, okay? Our 5-year-old kids really love to eat things like sugar and grains and chocolate and coffee. Oh my God, giving up coffee is like, you know, it's very high on the histamine list. So is chocolate. And they're both very high on the gastric irritants list. And getting people to give up chocolate and coffee is not easy. And yet, it can make a powerful difference in how you feel. So I get the most resistance around nourishment. And then the second thing I get the most resistance around is making sure you live in a clean environment. It's really hard. You know, it's expensive to do mold remediation. It's expensive to move. Even if you move, a lot of places are going to be moldy also. You know, what you need to know about EMF is you need to know if you're in a place that you cannot remediate. If you are, it's going to be really hard for you to get better. And although that's an extremely inconvenient truth, I don't want to be 5 years down the line with you, having you spend $10,000 or even $20,000 a year and have you have been living in a place for 5 years that prevents that treatment from working. It's a waste of your time and money and effort. and you're going to be so frustrated. And these are the patients that I see moving from practitioner to practitioner because nobody can help them get better. I totally get it. It's incredibly frustrating. But if you ignore the inconvenient truths, then you're participating in what is keeping you from getting well. Same thing with the limbic system retraining and avoiding dramatic things in your life. You know, it's not easy to do that. But my advice to my patients who have close family or friends who are not supportive, you know, I'll have people come and say, I want you to write a letter to my mom and dad because they really don't believe that I'm sick. And it's really important for them to believe that. And from my perspective, you can't control what they think. You can't make them believe anything. You can share things with them. And yet, from a place of what's going to help you heal, when you do that, you need to let go of outcome, okay? You don't have to convince them of anything. What you have to do is help yourself heal. And if you're attached to what they think, and that's important to you, okay? I mean, it's sad when they're not supportive, but if you feel like they have to be supportive of you in order for you to heal, you know, it's a huge roadblock and you're not going to get where you want to go. So let go of those things. The things that you can't change, you need to be in a place where you can let go of them and focus on you, okay? And there's a lot of family drama out there. I've heard it all, okay? I don't doubt that it's there, and I don't doubt that it's very real. However, in letting go of it, you're not saying, this doesn't bother me, this doesn't affect me. You're not saying, I don't think that this has an adverse outcome. What you're saying is, I'm going to heal myself and I'm going to let go of what other people think. And that's a place of empowerment, and that's a place that will allow you to get into remission. And I'm a little over, but I think that's it. And I apologize if it felt like trying to drink out of a fire hose. And I will take any questions you have.
And I just want to, Dr. Brown, I just want to remind everybody quickly that for anybody who has questions, if you could please type them into the chat so that Jody and I could read those to Dr. Brown to streamline everything. We'd appreciate that.
All right, and I have the first question already. This is Jody. This question is from Mary Beth. She wanted to know regarding treating mold and babesia and taking your thoughts on treating mold and babesia and taking, I cannot pronounce this word, diacetyl, the disulfiram,
Oh, disulfiram?
Thank you. I mean, I should not have been the one to read this. So there
okay, that's all right.
See my dyslexia there while treating mold.
Okay. So, what I have to say about disulfiram is if you have any mast cell activation at all, it is not the medicine for you. We've got close to 2 years of experience with it now. And actually Dan Kindler, who's my mentor, is one of the top practitioners in the country in terms of the volume of patients that he's treated with this. And every time I see him, he's more and more conservative about who he will start on it and who he will keep on it, because he's seeing a very high level of fairly major reactions that put people in a place where it's hard for them to bounce back. Now, if you're someone who doesn't have mast cell activation, and if you've responded well to prescription antibiotics, then it's a good choice. If you do not have mast cell activation and you have never been on prescription antibiotics, it's still a reasonably good choice, okay? But you need to be committed to following up with your practitioner frequently. There can be significant side effects with neurotoxicity. I'm sure those of you who are taking it are aware of that. But it's not, unfortunately, the magic pill that we were all hoping that it would be. I don't think that mold affects that a whole lot, or that babesia affects that a whole lot. I think mostly what determines whether or not you will respond well to the disulfiram is your state of reactivity. Does that help? I hope. Okay.
Okay, we have a question from Diane.
Mm-hmm.
She wants to know, if EMF from Comcast routers is so bad and widespread, how do you avoid it when you live in an apartment, condo, townhouse complex?
That is a really good question, and it's one of those things that I kind of, in some ways, throw my hand up in the air. And it's a little bit like, you know, people will say to me, well, EMF is everywhere, so how can I possibly, you know, protect myself? And it's a very valid perspective. However, there are things you can do that will make a significant difference. When you live in an apartment complex, and let's say you've got a gamer with a really high-powered router who's on the other side of your headboard of your bed, that's big. That's a big deal, okay? If somebody like Ryan comes and checks things out, he can at least tell you that, okay? And maybe you can move your headboard to the other side of the room, or maybe there's another bedroom you can use that would be better. In general, when people are looking for a new place to live, what I tell them is try not to be in an apartment complex building because you can't control the people around you. If you are going to rent a condo or buy a condo, make sure you're on an end unit so you're only sharing one wall with somebody. There is conductive paint that actually has copper in it that you can use to paint your walls. That's much easier to do if you own the place rather than if you're renting. And, you know, you did not hear this from me, but if it's important for your health, I would advise you to do it anyway and just don't tell the landlord. Because you're going to paint over it. The paint, the copper containing paint is a very dark color, so you're going to have to paint over it after you do it. So those are some of the things that you can do, but it's just a horrible situation. And until there is further acceptance in the medical community that we are poisoning ourselves with this stuff, it's not going to change.
Okay. This question is from Claire. Are there any risks to taking dialsopram, did I say it right, long term, as a relatively low dose?
You know, Claire, we haven't had enough experience with it yet to be able to answer that question with any kind of reasonable certainty. And like a lot of things with Lyme treatment is we do our best to make educated assumptions or guesses about what's going to work and how it's going to work. But I will say that this is a medicine that's been around for a long, long time, and it's been used at doses of 500 milligrams a day in alcoholics, and they've been on it for years. And there's not a lot out there in the literature that reports long-term consequences. However, we're a much more sensitive patient population, and in our patient population, everybody's reacting left and right. So I don't think that what happens to an alcoholic is going to necessarily be equivalent to what's going to happen to us. But at least we have a patient population in which it has been used long-term and there hasn't been any downside effect. So I wish I could be more specific. If it's helping you at a low dose and you get worse when you come off of it, it seems reasonable to me to keep taking it and just watch for, you know, the thing that we worry about the most is the neurotoxicity. And so watch for those neurotoxicity symptoms. And if they're happening, then talk with your provider about whether you should be changing your dose or going off of it.
Okay, the next question is from Mary Kay. She wants to know what would be considered problematic gut symptoms that would cause one to need to avoid the gastric irritants?
Well, those are classic symptoms of IBS, and just going down the list, it's going to be bloating, abdominal pain and cramping, constipation, diarrhea. I actually think that many IBS patients also have reflux, and being off of gastric irritants will help reflux significantly, I've found. So those are the things that we're talking about.
All right, this one is from Lisa. What kind of test do you take to find out if you have hypercoagulation? Geez, I'm getting all the words I can't pronounce, and I'm assuming it is not covered by insurance.
Actually, they are covered by insurance, and there's a whole panel that I got from Ann Corson at that lecture that I send people to LabCorp for. Now, I will tell you that commercial insurance covers them. It's not a problem. When it comes to Medicare and Medicaid, it seems to be spotty, And I don't know why that is. But for the most part, even with Medicare and Medicaid, it gets covered, okay? It's the panel that she recommends is probably about 15 vials of blood. But I think it's really helpful to do that and to have, you know, confirmation from lab tests that there's really something going on that's affecting how your red blood cells are behaving. And if anybody wants a copy of that, again, email me, tell my staff that you were at this talk, and we'll send you a copy of the LabCorp requisition that we use.
The next question is from Jen. She wants to know for, and hopefully I say this right, disulfiram, is it still required to get to a max dose, or is it known yet if people have success being on it at a lower dose for a long time? I had to start at such a low dose and it's taken me a long time to increase due to sensitivity, but seeing improvements.
Good, okay. So keep going up incredibly slowly is what I have to say. Now, what I'm hearing from Dan when I check in with him, and he's got a lot of experience, is that he is starting people at lower doses and he's increasing them more slowly. And sort of his philosophy at this point in time, and you know, I'll tell you that over the past 18 months, what he tells me about disulfiram changes almost every time I see him. Okay, so this is a moving target. But where he's at right now is that if you're at a particular dose that is definitely making you feel significantly better, he's telling people to stay there rather than trying to push it up to some, you know, number of milligrams per pound, that kind of thing. He was pushing people, and he had a lot of people who had pretty major Herx type reactions and then couldn't tolerate it after that. So if you're at a point where you think it's significantly improving your symptoms, stay there, okay? And again, you know, talk to your practitioner, but I wouldn't push it. And I think you can get a lot of benefit from that. So
Okay.
no, there is, at least from his perspective, there is no longer a target dose.
Okay. This one is from Jessica. What are your go-to supplements and prescriptions for treating mast cell?
Okay, so for mast cell, I'll go down the list, but it's long, okay? And Billy is, you guys all know Billy. Billy is one of the best mast cell experts I've ever worked with. So she can give you lists of things also. So on my list, number one is I put people on cromolyn because most of the time, 80% of the time is covered by insurance. It's a prescription. And it can be very effective very quickly. It helps me get a diagnosis and it helps people feel better. So cromolyn is my number one. My number one used to be ranitidine, but it got pulled off the market. And I wish I could get it, and I can't. But it used to make people a lot better really quickly. And, you know, if you were taking over-the-counter Zantac, you were getting it pretty cheap. So can't do that anymore. So cromolyn is number one. Then there's what we call H1 blockers, which are going to be Zyrtec and Claritin and Allegra, okay? You usually take those at twice the recommended dose, so morning and evening. There are a couple of supplements that I really like a lot that contain a substance called luteolin. Theoharides, okay, is a Greek PhD researcher. And he's one of the people on the planet who's done the most mast cell research, and his go-to treatment for mast cell is a substance called luteolin. It is a mast cell stabilizer, which is what cromolyn is. And it is available in this country in 2 supplements that I know of. There might be more, but the ones that I have that I recommend, number one is Perimine, Perimine. And it's a combination of luteolin and rosmarinic acid, which is one of the chemicals or biologically active molecules that is in rosemary. it's a nice combination. And it also turns out that rosemary is actually quite effective against COVID. So I feel great about giving that. It'll help prevent the infection if you're exposed. And oh, by the way, I will just put this in as an aside. Well, we're talking about supplements anyway, having an adequate, optimal vitamin D level is one of the most important things you can do for treating these illnesses, and absolutely the most important thing you can do to prevent COVID, okay? Your levels should be between 80 and 100. And if they're not there, take more and keep checking your levels until you get there, okay? It's number one on my list of supplements, okay? Okay, now, mast cell treatment. I'm looking at the list in my mind and I'm going down the list. The other supplement that contains luteolin is called Mirica, M-I-R-I-C-A. It has luteolin combined with PEA, and PEA is a pretty potent anti-inflammatory, so that's also a very nice combination, okay? I often have people on both of those and on cromolyn and on an H1 blocker, okay? In terms of prescription medications, some people do well with Singular, but it has a black box warning for depression. And so if there's any psychiatric stuff going on, I tend to try to avoid that unless it's one of my Medicaid patients who can't afford supplements, and then we'll try it. Also, there's another prescription called hydroxyzine. It's very cheap. It's been around for a long time. It's been used in the psychiatric community for a long time to control anxiety. It helps you sleep, and it is also a mast cell stabilizer. Also on the list of mast cell stabilizers, CBD, THC, okay? Very potent mast cell stabilizers, and also anti-inflammatory and good immune support, okay? If you're not on a CBD product, spend some time trying to find one that works for you, because I think they can be very, very beneficial. Ketotifen, I haven't had as much luck with clinically, because people tend not to tolerate it very well in terms of sedation, okay? I do have a few people, maybe 2 or 3, who can tolerate it at fairly high doses, and it helps. It is an antihistamine, and I think it also acts as a bit of a mast cell stabilizer. Oh, and let me just throw that in there because I didn't say it before, so a little bit of an aside. It is rumored, but I've heard it in several places, and I can't tell you if it's true or not because I don't think anybody studied it, but it is rumored that disulfiram is actually a mast cell destabilizer. And so someone who, didn't have trouble with herxing easily or having bad reactions and being really sensitive might actually move into that state through the use of disulfiram. And again, it's a theory. It's a rumor in our community. I don't know that it's true, but based on what I've seen, what Dan has told me about his experience, I think it could very well be true. Okay, it may explain some of the things that he's been seeing. Okay, so that's what I do for mast cell activation. Now, my mast cell patients are usually on anywhere from 4 to 6 different meds and supplements before we get their mast cell in a state where I feel like it's maximally treated and we're not getting any further benefit. I really push this. If you're on just one thing for mast cell activation, it's not enough, okay? I think 4 is the minimum. Okay.
We have a question from Lynn. She wants to know, can you have a totally negative Great Plains mycotoxin profile after sauna and glutathione IV and still have mold issues?
Absolutely. Now, when I see this, it is always universally my sickest patients. The patients who can barely get out of bed, the patients whose lives have been completely compromised by the illness, my patients who have extreme hyperreactivity and can hardly take anything. Those are the ones that I see negative mycotoxin tests on. And it's simply because their detox pathways are so shut down that you're not going to see it come out in the urine, okay? What happens when you go into an infrared sauna or when you take glutathione, it helps to mobilize the toxins in your body and get them circulating through your bloodstream. But you have to have pathways that work in order to get those toxins from your bloodstream into your urine in order to have a positive test. And some people, this part of the pathway is so compromised that it doesn't matter how much mycotoxin they've got circulating in their body, it's not going to show up in their urine. And one of the things that Neil Nathan describes in his book with those types of patients is that oftentimes after being on treatment for mold toxicity for 6 months, you repeat the urine mycotoxin test, and now all of a sudden it's positive, okay? And that's because they've been given supplements that support those detox pathways, and you know, the toxins are leaving the body now in a much more effective way. So in essence, it means that the treatment's working. It doesn't mean that you have more mold toxins in your body. So it makes the interpretation of those tests very challenging at times. But if I get a really strong history from someone that they're living in an environment that has made them significantly worse since they moved into it, and the symptoms that they have are highly suggestive of mold, such as having to pee all the time and being thirsty all the time, that's called diabetes insipidus. It's absolutely indicative of mold toxins. And chemical, light, and sound sensitivity are also very high on my list for mold toxicity. If somebody's got those symptoms and they tell me they felt worse since they moved into their current apartment, and, you know, especially if they tell me they can see or smell mold, you know, I don't care if the urine mycotoxin test is negative. The reason I have them do it in the first place is because it can give me valuable information about what binders to put them on. There are certain binders that are better for certain toxins. And so I find it very helpful for that. But if it's negative, it doesn't mean you don't have it.
Okay. This message is for a question, I'm sorry, is from Sandra. I have had to be on Medicaid and can't afford to pay for all of the out-of-pocket expenses. Can you refer me to other sources?
All right, so I think oftentimes people who are in your situation will do a lot of internet searching and treat themselves with things like the Buhner protocol, and you know, there's a lot of other ones out there too that that can be helpful. What I will say about Buhner is, well, first of all, this guy is absolutely brilliant, and I'm so glad he's on the planet. And he did his original research and his clinical trials back in the day when people were getting IV antibiotics for 6 months and recovering. So his protocol is pretty aggressive. And you're taking a lot of antimicrobials all at once. You're not starting them slowly. You're not introducing them slowly. You're not backing off if you have herpes. That's something that if you have a tendency for hyperreactivity can make you worse. So, you know, from my perspective, working with someone who is a seasoned Lyme literate doctor who's had these experiences is always the preference. And I understand that it is financially unfeasible for some people. And I really wish we lived in a different world where that wasn't the case. So there's nothing that I can refer you to that I can say, this is a great place to go. They're gonna, you know, the website is gonna talk you through how to do this. And even if you're hypersensitive, they're gonna take that into account. You know, I was on somebody else's website the other day when my patient said that they went to this website and they got this treatment protocol for Babesia, and he wanted to start it. And this is a guy who's got pretty severe mast cell activation syndrome, and that wasn't addressed at all on this website. And I said, you know, this is going to do you a major disservice if you try to do this. I think it's going to make you worse. But so I'm hesitant. Even people who are seen in the current present environment as experts, I feel are still not sensitive enough to the issues of mast cell activation. And again, I'm speaking from a very skewed place. I have bad MCAS. I have bad EMF intolerance. And so, yeah, it's gonna raise major red flags for me if I see somebody who's not addressing those things or even mentioning them.
Okay.
So I wish I had a resource for you. I'm sorry.
All right, this next one is from Claire. What is the latest effective treatments for persistent Bartonella infections?
Man, I wish I had an answer for that, Claire. I really wish I could. And all of you probably know this, but it's the one tick-borne infection that I think is the most challenging to treat. Now, here's what I'll say, and I'm going to address this pretty directly as I'm going to talk about methylene blue, because it's the newest kid on the block in terms of Bartonella. And it came out of the same type of research that gave us disulfiram. These are basic level investigational scientists in a lab who are looking at whether a certain organism gets killed in the test tube with a certain product, okay? And they test, 300 different things. When somebody did this for Bartonella, the thing that came out on top is something called methylene blue. If any of you have ever done organic chemistry or physical chemistry or any of those labs, I'm sure you know about methylene blue. It stains everything blue, and it's one of the things that you put into your reactants to see if things are changing. And okay, so it's a chemical. It's not an antibiotic. It's not anything that's ever been touted as being antibacterial. However, in the test tube, it kills off Bartonella. And so what we're seeing now is many practitioners are recommending its use. Now, from my perspective, I tend to be pretty conservative about new stuff. I didn't jump on the bandwagon with disulfiram right away, and I'm kind of glad I didn't. I do have some patients on it, but I'm pretty selective about who I put on it, and then they have to absolutely agree that they're going to see me every 4 weeks, because otherwise it's not going to work. But with disulfiram, we had 50 years of experience of it being on the market and being used in a specific population, which was alcoholics. There was a lot of information out there in the literature about bad reactions that have been seen, and the possibility of neurotoxicity and the possibility of psychosis because it can increase dopamine levels. So it had a known side effect profile, and it had a large population of people that had been used in for a very long time. This is stuff that's never been taken internally. And I can tell you, I'm really uncomfortable. I won't prescribe it. If somebody can come back to me in 5 years and say it works and there's no side effects, there's nothing we need to worry about, then I might think about it. But when it comes to new things like this, I'm pretty conservative, and I really want to know what the data says. And this is just something that I don't think we have enough experience with for me to be comfortable prescribing. And I know there are people out there that are doing it, but not me. Other things, Bactrim is pretty standard of care in terms of prescription antibiotics, and rifampin. There's also something called rifabutin, which has more side effects than rifampin, but is stronger and sometimes is much more effective. There are the herbals like Abart and Banderol and MC Bart. They all can have a positive effect. I think with Bartonella, what I've heard from people like Joe Burrascano, who is one of the grandfathers of Lyme treatment, is that it has to be multiple drugs. Okay, you're not going to do it with just one thing. So somebody might be on 1 or 2 herbals plus 1 or 2 prescription antibiotics, and maybe you're going to get it under control. And I know that's not a terribly hopeful thing to say, but on the other hand, there's a lot of inconvenient truths with these illnesses and with treating them. And Bartonella is a really tough one.
Okay. This question is from Julie. I am at 2.5 years into treatment and passed this to at least 2 of my kids in utero. I am now 37 and really want to have a 4th child. Youngest is 3.5 and asymptomatic so far. Your office has said you have protocols for pregnancy to continue treatment for the mom as well as to protect the baby. This is the first I have heard of this. I heard that this is possible. What treatments do you think are safe?
So the only thing that's been studied, and it was Horowitz that did this research, and it's well documented, is that if you take prescription antibiotics, and the one that he used was amoxicillin throughout the entire pregnancy, you can decrease transmission dramatically. You can't drop it down to 0, but you can decrease it a lot. And he's talking about significant levels of antibiotics throughout the entire pregnancy, okay? And if you're gonna do that, then we put you on a lot of gut protection, you know? You're gonna be on Saccharomyces, which is the only thing that's ever been proven to decrease the risk of, oh, now I'm blanking. Okay, see, I've been talking for too long and my brain's starting to wig out. The gut infection that you get from taking too many antibiotics. It starts with a C, and a lot of you will already know what it is, but I can't think of it right now. It does really decrease the incidence of getting that. And we get you on a good probiotic. And if you don't have mast cell activation syndrome, I put you on grapefruit seed extract because it's really good at keeping down the yeast population in your gut. And there's other benefits to it also. But it is citrus. And so if you have mast cell activation, you can't tolerate it. So lots of gut protection and then take the antibiotics for 9 months.
Okay, let's see. This next question is from Claire. After removing Wi-Fi from your home, why is there an initial period of feeling worse? Is this from the immune system working better and infections being killed off? Also, how important is it to mitigate dirty electricity versus removing Wi-Fi?
They're both important, but the Wi-Fi is more important. The dirty electricity is actually really easy to take care of. There's just these things you plug into the wall. But if you need a lot of them, it can get expensive. So from my perspective, Wi-Fi is more important. Nobody understands the withdrawal, and it doesn't happen to everybody. It's maybe about a third of us are going to have withdrawal, and most likely not as significant as mine was. The best theories that I've heard about it is it's not a Herx reaction. It's not a die-off reaction. Our bodies are amazingly adaptable. And what they have done over the years is they've tried to adapt to being in this kind of an environment. What those adaptations are, I haven't done enough of the reading the papers and reading the research that the cellular scientists have done, you know, exposing cells to EMF and what happens to them. But our bodies are amazingly adaptable. And when you suddenly take that EMF away, they have to learn how to function differently in a lower EMF environment. And I think that's what the withdrawal symptoms are about. And again, I can't tell you on a physiologic basis exactly what's happening. I just know that this is a real thing that does get seen and that you will feel better when you get through it. But it's not because of die-off.
All right, this message is from Robin. She would like to second the pregnancy question. Although in her case, it would be our first child, but I'm headed into my upper 30s and unsure about waiting an indefinite amount of time, potentially several years, for treatment to be completed before trying to expand our family. I would add, my symptoms are not horrendous. My concern, though, is about number 1, herbal therapies during pregnancy, and number 2, let me just scroll down here, sorry, and number 2, passing this diagnosis onto an infant.
So I'm sorry, I can't tell you off the top of my head what the transmission rate is or has been documented without any treatment. I think that it's definitely over 50%, and I think it might be as high as 80%, but I don't know that, okay? And remember that it might get transmitted, and the child's genetics are enough different from yours that they're really not at risk for developing a chronic infection. So they may harbor the organism, but they may not get sick from it. So the other thing is that with herbals, and my preference is always to start with herbals if I can. Herbals, number 1, haven't been studied like Horowitz has done with antibiotics. And number 2, every single manufacturer will tell you not to use them in pregnancy. So I really don't think it's an option. I think if you want to treat during pregnancy, you're obligated to use prescription antibiotics.
Okay, I actually have a question. So I have a 14-month-old granddaughter. Mom has mold, Lyme, etc. What age do you recommend getting them tested? And do you recommend getting them tested if they don't show any symptoms?
Don't get them tested if they don't show symptoms, because again, their genetics, 50% came from mom, but 50% came from dad. And if he's got a good set of genetics, it may well be that this is a child who will never have illness problems, okay? If they are showing symptoms or signs, then yes, get them tested. I think it's important to know. It could be challenging to treat kids, but it's certainly not impossible. The kinds of things that I look for with Lyme disease in kids, if you know, it's possible that it's been transmitted in utero. Kids that are diagnosed at a very early age with ADD or behavior problems or extreme sensitivity or autism, pandas, okay? Those are all big red flags for me if I know that mom has Lyme or tick-borne diseases. Those are the things that you're going to watch for. I will go so far as to say that if any child has onset of severe treatment-resistant psychiatric illness prior to middle school, in my mind, that's Lyme until proven otherwise, okay? Now, that might be somebody who has had a history of early childhood trauma, and that's been a trigger, but I would still not rule out that there's a tick-borne disease there.
All right, this question is from Alex. Do you use or suggest technologies like PEMF, like AMP coil, or ionic foot baths, like ionic cleanse?
So with a lot of these detox methods, again, we're right back to trial and error. Because if we go back to that conversation that we had about whether the urine mycotoxin test is actually showing what's really in your body, okay? What happens with ionic foot baths is that, again, it can pull those toxins out of your deep tissues and get them circulating. But if the pathways that then excrete the toxins, either through your stool or your urine, aren't working very well, those treatments can actually make you worse. So when we're talking about detox, I will encourage patients to try various things like infrared sauna or ionic foot baths and see how they feel, okay? I'm somebody who I can't tolerate glutathione, I can't tolerate infrared sauna, I can't tolerate ionic foot baths, and my methylation profile looks like crap, okay? And that's why I can't excrete these things once they're circulating. So I wish I had a standard answer. I don't necessarily recommend them, but they are on a list of additional treatments that I give to patients saying these are all detox treatments that you can try, and if they help you and it's in your budget, then do them, okay? But also on that list, and very high on that list, is intermittent fasting. It doesn't cost you a damn thing, excuse my language, and it's really, really effective. So if you don't know about intermittent fasting, go learn about it. It's really awesome.
Bear with me 1 minute here.
It's okay. And while we're waiting, I just want to say, if I know you guys have a 2-hour window, if anybody wants to hang out and ask more questions after 4 o'clock, I'm happy to do that. I won't guarantee that that my brain function might not be deteriorating by that time, but if you bear with me, I'll stay around as long as you want me to.
Okay, here is one from Julie. She said, I will add, I for sure have Babesia, Bartonella, Lyme. My 7-year-old is now in remission after 1.5 years of treatment. My 10-year-old and I are a lot better than I was, but still have a ways to go. Also have EBV numbers that are high after 3 years.
So let's talk about EBV. You notice that I did not put persistent viruses, not retroviruses, but I did not put persistent viruses on the list of things that will prevent you from getting well. There's some controversy out there in the Lyme community about that. However, I will tell you that at the last 2 years of conferences I've been at, the consensus, overwhelming consensus from the thought leaders in this field is that reactivated viruses should not be treated unless it helps you feel better symptomatically. And here's the reasoning behind that. In medical school, we're taught about infections that are only present in people who have compromised immune systems, okay? That's what this is. So everybody has EBV in their body, okay? And cytomegalovirus and herpes viruses. We're all exposed to them in childhood or early adulthood, and our immune systems take care of them and they go into remission, but they never leave our body. But then if something comes along that really seriously compromises your immune system, like a moldy environment plus an active tick-borne disease, plus mast cell activation, then your immune system isn't functioning well enough to keep those organisms from coming out of hiding and multiplying and being present on your blood test. Now for me, again, from a pragmatic perspective, the question is, are they contributing to your symptoms, or are they just simply present because your immune system is so dysfunctional? If the former is true, if they're contributing significantly to your symptoms, then it's worthwhile treating them, I think. Even though we're not getting to a point where you're going to get rid of them, the only way you're going to get rid of them, or well, you're not going to get rid of them, but the only way they're going to go back into remission is if your immune system starts functioning better. And that's only going to happen when you're in a mold-free environment and you're in an EMF-remediated environment and your tick-borne diseases have been treated, okay? So that may not happen for 5 years. But in the meantime, if we give you an antiviral treatment and you don't have any other moving pieces at the time, and you can confidently say, this is maybe 20% better, then I will keep people on antivirals for the entire time that we're doing other things, because I'm a big fan of decreasing symptoms, even if we're not treating an underlying cause, okay, if it's effective and if it's safe. And long-term antivirals tend to be quite safe for most people. So.
This question is from Lynn. Are there any antihistamines that you can take for mast cell issues when you have high blood pressure?
I do not have an answer for that. It's not something that I've researched. I have very few patients in my practice who have high blood pressure. It's usually the opposite. Oh, that was one thing I forgot to say. I'm glad it popped into my head. Ann Corson, who's the woman who gave the lecture on hypercoagulability, said, quote, "I have never seen a POTS patient who didn't have hypercoagulability." Okay, and I didn't put that on the list of symptoms. You have my apologies. So if I have somebody who has a lot of lightheadedness, it's one of their major symptoms, or they definitely have a diagnosis of POTS, I'm going to do hypercoag labs on them right away. Okay. All right. Now I got off topic. What were we talking about? Can somebody remind me?
Yeah, I can help you. Hold on, I'll go back there. For antihistamines, is there
antihistamines, yeah.
take for mast cell if you have high blood pressure?
I really don't know, and I would just invite you to do a Google search and look for antihistamines that can be taken with high blood pressure and see what comes up. I just don't know the answer. I'm sorry.
Okay. All right. This next one is from Mary Kay.
Oh, and by the way, the name of the woman who gave the talk is Ann Corson, C-O-R-S-O-N. She's been a Lyme practitioner in Pennsylvania for a long time.
The question. Mary Kay wants to know, I've been treating CIRS and Lyme for 2.5 years, lost 60 pounds in the process. However, weight is coming back on without changing diet. What do you commonly see as a root cause of inability to lose weight / weight gain despite excellent organic and gluten-free, grain-free, sugar-free, dairy-free nutrition?
I can tell you my suspicions. I can't tell you that this is 100% true for you. But on my list of reasons that you have something that I refer to as weight loss resistance, toxins are number one on the list. And I would look to see if you have a new source of mold in your environment. I don't know when you did the mold testing on your house, but if it was 2.5 years ago and you're having increased weight, it might be worth looking at that again. Yeast is also on my list of things that will cause persistent weight gain, but you're eating a nourishment program that is not supportive of yeast growth, so I doubt that that's the issue. And then the third thing that's on my list of reasons for weight gain is just simply high inflammation. So I don't know where you're at in your treatment and if your other symptoms have gotten worse in the same time frame as the weight has increased. But if in general, you know, if I was going to take a detailed history and you said, oh yeah, I started putting on weight 6 months ago, and about the same time, you know, my brain fog got a little bit worse and my fatigue got a little bit worse and my exercise tolerance got a little bit worse, then, you know, yes, your inflammation is high and that may be driving what's going on, but also there's something that happened 6 months ago that's making you worse. And you need to play detective and figure that out. But right, number one on my list of suspects is mold that you don't know about.
All right, this one is from Claire, but Claire, I'm going to ask you to come off mute and go ahead and ask this question because you got a lot of those prescription meds in there that I can't pronounce, and I'm going to butcher your question.
Hi,
so
Claire.
Speak freely, Claire, and then mute after your question, please. Thank you.
Oh, I don't really have a question. It was a comment after.
Oh, it was a comment. Okay.
After you answered my question, Nancy, about the treatments for persister Bartonella infections. I just said, I tried methylene blue, but I couldn't tolerate the mood side effects, unfortunately. And this is from someone who's been on disulfiram for a year, and I managed those neurotransmitter side effects. And then just another comment that I had an easier time with rifabutin than rifampin. So if you don't do well with
interesting. Good to know. Yeah. I haven't had a lot of experience with it. And after the last conference that I went to in March, I'm probably going to be trying it a little more often with people and seeing how things go. So yeah, thanks for that feedback. I appreciate it.
I didn't follow the normal, whatever the normal.
Is there anything normal about these illnesses?
No, but thank you for answering my questions.
Okay, you're welcome.
And I don't know if you want to answer this because you kind of have. Somebody, Julie wants to know what you recommend for chronic Epstein-Barr. So, and I know you kind of touched on that a little bit, why you thought it was there.
It depends kind of what your budget is, but to be honest, my first choice is usually Valtrex because insurance covers it. And the herbal antivirals are going to be another $60 to $70 a month. And my patients are already spending a ton on supplements. Now, if I have somebody who's very adamant that they don't want to use prescription meds, I will certainly prescribe the herbal antivirals. And usually it's the Byron Whites. There's one for cytomegalovirus called ACM, and then there's one for Epstein-Barr called AEBH6. And that's my go-to if they want to use herbals. But Valtrex at 1,000 milligrams twice a day, the problem with that is that it is not an ideal antiviral for either cytomegalovirus or Epstein-Barr virus, but it does have some activity against them. And so then what I'm doing is I'm just doing a trial for a month to see if symptoms are better. And if they are, then I'll usually keep people on them for a year and then take them off and see how they do. And I have some patients who cannot tolerate coming off their antiviral treatment. It just makes them significantly worse. And so we just keep them on it.
All right, before I ask this next question, I just want to tell everybody we are 5 minutes till, but I know Nancy, you said you will continue. So we have a lot of questions coming in, so we're just going to keep feeding them to you until you call mercy, okay?
Yeah. If I get to the point where my brain is just completely.
Then you just give us, and then we'll wrap it up.
Okay.
All right, so this one is from Sandra. Adderall, to help with my symptoms of severe brain fog and fatigue. It has definitely helped me to be able to periodically think more clearly and problem solve a bit better. Do you have any feedback on that?
I'm a big fan of Adderall if it helps your brain function, okay? I don't have any problems with that at all. And in fact, I will encourage some of my patients to do a trial just to see if it helps. Now, usually what I'm looking for is if somebody's having a lot of trouble with focus and multitasking, then I suggest maybe trying this, okay? But a lot of my patients really do much better if they're on something like Adderall. I have no problems with it at all.
This next one is from Lisa. I recently had a muscle test and found out my mold toxicity level is still high and have symptoms of Bartonella. What are your thoughts on muscle testing? My doc said she does not retest again for Lyme, rather she prefers muscle testing.
So muscle testing can be very useful and very accurate in the right hands, okay? And I'm going to say this simply because I know there's a lot of you out there who might resonate with this. I have had a very intense spiritual practice now for 12 to 15 years. And one of the things that I did inside of that practice was I was trained as a medical intuitive and I was trained as an energy worker. I have a lot of friends who are in this field also. One of the things that I will tell you that I have picked up on an intuitive level and has been confirmed by other people that I trust is that the organisms themselves that are infecting you can energetically interfere with muscle testing. Even if you read carefully through Stephen Buhner's books, he says exactly the same thing. He has said that he's seen many people come to him who have failed treatment because they've been told through muscle testing that they don't have an infection anymore, or that, you know, and somebody stopped their medicines, or they do have an infection and then they got really worse. And his preference is to treat people with a protocol, which he spent a lot of time developing. So from my perspective, I think it can be a useful tool to guide you. And I would rely on it with, not with a sense of skepticism, but with a sense of, I want to listen to my body and tell me what my body tells me when I do this, okay? I want to look for other things that confirm that this muscle testing is accurate. You know, what happens to me when I do the suggested treatment. I want, for the most part, the most important thing for me, and I talk to my patients about this a lot, is that if you have a strong intuitive sense that something is either good for you or not good for you, please don't ignore that. It's really important. We all have an intuitive connection on a cellular level with our bodies, but we learn how to not listen to that. If you can tune into it, if you're getting a strong message internally, please, please pay attention to it. And don't necessarily rely on someone else to be able to accurately tap into that and interpret it. I hope that's helpful.
This next question is from an email address, so there's not a first name, but I will ask the question. Where does yeast come into treatment? Treating yeast, and what other things can we do to decrease toxic load?
Okay, so yeast is important in creating symptoms in some of my patients, but it was not on my list of things that prevent you from getting into remission. It's kind of a gray area for me. If somebody has a lot of symptoms that are suggestive of yeast, then I might try treating it fairly definitively. But if they are following a low inflammatory diet, it's unlikely that yeast is going to really have much of a foothold. The time when I will intervene is if somebody's really trying to stick to a nourishment program, but they're having a really hard time with it because of intense cravings. And intense cravings, especially for sugar, are a big red flag for me that there's too many yeast there. So then what I'll do is focus on that so that they then have more ability to stick with a nourishment program that's going to help them get better. Now, yeast in and of itself can contribute to fatigue and brain fog, just like the viruses can contribute to fatigue and brain fog. So it's not like they're not causing symptoms, but they don't do that in everybody. Just like with the reactivated viruses, they don't necessarily contribute to symptoms. So if I get evidence that they're contributing to symptoms, then I will address them specifically. Otherwise, I trust that the nourishment that you're engaging in and the other things that we're doing for your immune system will eventually take care of the yeast problem. And there was another part of that to that question?
The second part is, sorry, I scrolled too far. Hold on. Yeah, it was just where does yeast come into treatment? And then as far as treating yeast, and what other things can you do to decrease toxic load?
Oh, okay. So decreasing toxic load is really important for your improvement and ultimately getting you into remission. And so with the mold/SIRS protocol, you know, we get you on binders and try to get you in a clean environment. But I can tell you the one thing that I see universally in my patients, there's not a one that I've had adequate testing on that hasn't shown this, is that we all have really significant compromises in our methylation pathways. In fact, I've seen it so consistently that I would hazard to guess, and again, I can't prove this, but I would hazard to guess that if you don't have significant methylation pathway defects, you're not going to get these things, okay? So I always get my patients on methylation support, and that looks like, you know, vitamin B6 or P5P, which is the precursor to vitamin B6, and methylfolate sometimes not, depends what the genes are. Methyl B12, again, sometimes not, depends on what the genes are. Lithium orotate can be very helpful with methylation pathway defects. Molybdenum, especially if you know that you have a CBS SNP, you need to be on molybdenum. It really helps. So one of the things that I will ask early on is whether my patients have ever done 23andMe. If they did it several years ago, then I can get a complete methylation pathway profile out of that. If it's been done within the last couple of years, the people at 23andMe changed their chip because of pressure from the federal government, and I now cannot get what I want. And I haven't found anybody else out there that's providing what I want for less than $500, and I don't think it's worth $500. But methylation is what I focus on for detox. And of course, the mold protocols.
Okay, and this last question is from Robin. Are you at all familiar with the treatment modality for Lyme that uses cold lasers with guidance of a biofeedback machine like the Avatar and or muscle testing? Apparently a number of local people have had notable success with laser treatment for stealth microbes specifically. Is it of interest since it can theoretically be combined with other protocols?
It's definitely of interest, and it's not something that I know much about, okay? You know, I'm always thrilled when I'm always learning from my patients, and I'm always thrilled when I learn about new modalities that people have had success with. And I almost always come to that from a perspective of, and this is just from my years of experience. I doubt that this is something that's going to get you into remission, but you know, it may help with symptoms. There's a lot of stuff out there that helps with symptoms and really doesn't do anything to get you into remission. But if you can find something that helps symptomatically and helps move you towards remission, then that's awesome. I just don't know enough about this modality to be able to answer that. I'm sorry. There's only so much my brain can hold. And my learning curve right now is hypercoagulability, and the next one after that is probably going to be parasites. So,
well, that follows a question. We just got another one, and this is regarding regarding parasite. This is either I apologize if it's Zoe or Zoe, so I apologize if I'm not saying it right. But the question is testing for parasites and ruling that out worth doing?
Yes, if you have typical parasite symptoms and you're not responding to treatment of those first 5 things that we talked about. Okay, it's not ever number 1 on my list, but if you have symptoms that are highly suggestive, then yes, and I'm going to send you to Billy for that because I don't know enough about it. But the typical symptoms that I look for are gastrointestinal symptoms that in which bloating predominates. And so like a typical thing would be somebody, when I first see them, gives me a whole long list of gastrointestinal symptoms, and I put them on the low irritant diet. And they come back a month later and say, oh, my pain is gone, my diarrhea and my constipation is gone, I feel so much better, but I still have all this bloating. And I'm like, okay, we need to test you for parasites. I use the Para Wellness test. I think it's the best that's out there. And even then it's, you know, like most of these infections, oftentimes the testing doesn't show it even when you have it. So you just do the best you can.
Okay, this next one is from Julie. What are your best recommendations for fighting Babesia? Will the amoxicillin treat all of these in mom, Bart, Babesia, and Lyme, and protect baby from these, or just Lyme? What are risks to mom and baby of this antibiotic the whole time?
So that's really a great question. And I will tell you that Horowitz never studied that. There's nothing out there in the literature. I can't tell you, okay? We know that taking amoxicillin will significantly prevent potential transmission of Lyme, but we don't know about any of the other infections. I can tell you that some of my sickest patients have been, I'm thinking of 2 right now, have been male who I am almost sure got Bartonella in utero. And, you know, this is one of them had his first ruptured disc at age 8 while he was running. And the other had his first ruptured disc, trying to remember now, I think at age 16, okay? That's not Lyme, you know, that's Bartonella. It really loves the spine and it causes a lot of really, really bad spine pain. And these are both young men who've been completely paralyzed by their pain. And when you take a careful history about mom and mom's symptoms, it lines up that they probably got infected in utero. So I think it's possible, but I don't think it's been studied. And it would be really hard for me to recommend that someone who has BART and BAB be on a full plethora of prescription antibiotics throughout 9 months of pregnancy. I would have a hard time saying that that would be okay. And I can't guarantee you that they're not going to be transmitted. So we just don't know enough. I wish we lived in a different world where, you know, these were illnesses that got a lot of funding and had a lot of studies. And by this time, you know, 30 years into this, we would have the answers to some of those questions, but we just don't.
Okay. Well, I believe that we are at the end of our questions. Thank you so much, Nancy. We have tons of people that are in the chat just thanking you for your time. And on behalf of all of us, this has been extremely informative, very helpful, and amazing participation. So thank you so much. I wanted to let everybody know this is recorded. So tomorrow, Joanne and I will get this posted both on Meetup as well as on Facebook. So if you do want to review anything that Nancy had indicated. Also, we have a link on the Meetup group, and then there's also a link that was posted in chat that gives you more information about her practice and resources, etc. And I just want to wish everybody the very best. Our next meeting will be in December. I should have had this at the front of my brain, and I did not. December 6th, I believe. Yep, thank you, December 6th. And that will be an open forum. Thank you all, everybody. And be well, be safe. And Nancy, thank you for what you do.
Well, thank you. And thanks for asking me, Joanne. It really was nice to be here. Billy had asked me several times to speak last year, and I was just in a place where I was too overwhelmed with dealing with my own illness, and my brain just wasn't working. So I'm thrilled that I can actually do this.
All right. Everybody, be well, stay safe. Thank you.
Okay.
Bye-bye.
Thanks for all the comments, everybody.